right. Hey everyone. My name is Dr. Mike Murray. I am a chiropractor and wellness professional and the owner of Brooklyn Body Blossom, located in Williamsburg, Brooklyn, New York. Welcome to my first YouTube video, and bear with me as I fumble through this, possibly. Anyways, today I would like to talk about a topic that's very near and dear to my heart, and this is posture, right? One of the biggest things I see when walking around the neighborhood in this city is really poor posture. And I have a saying in this office: if your posture is shit, the pain won't quit, right? So I have a lot of people coming back in and they're saying things like, well, I'm still starting, I feel this pain still in my neck, and oh, it's still in my low back. And I see them out in the waiting area, or I see them, around the neighborhood, and they're looking down at their phones, right? I'd say that's the biggest cause of bad posture at this point, all of our electronic devices. So I take a look at this person and they're waiting, and here's what I see, right? They're just hunched over looking at the phone. I've got news for you. The pain's not going to quit if your posture is shit. Right? If it looks like that, it's not going to stop. It doesn't matter how much you go to the chiropractor, the massage therapist, the physical therapist. If you're not doing what it takes outside of the office to improve your posture, the pain just isn't going to stop. So we need to focus on a few simple cues that are going to help us maintain an erect posture, right? Now, before I get into the cues, I'm just going to give you one simple trick that allows me to keep my cell phone at eye height. This is something I share with many people that come through the doors here, all right? What I like to do is actually build a shelf with my forearm. So I'll just gently wrap my forearm around my rib cage, and then, right, I'm gonna block my face here, I can lean my elbow into this shelf that I've just created, and now I can hold my cell phone up at eye height, right? So instead of being down here looking at the phone, I've now brought it up to my eye level, and I no longer have to round my back or look down at it with my neck, right? So this is just a really quick tip that you can use when you're waiting for the subway, waiting for the train, I don't know, waiting at the doctor's office, anywhere to keep your posture a little bit better, all right? So next I'm going to push the camera back and edit the video and talk about a few quick postural tips to help you keep an upright position, all right? The key thing here is that we want it to be simple. These are just very simple things that you can do on your own that don't require a whole lot of work. All right, another saying I have is that posture is not hard work, it's conscious work. So it just takes you noticing that you're out of alignment, that your posture is poor, and then bringing it back into alignment. All right, so a few simple tips. Here we go. Alright, I hope you can hear me well enough. Let's see if I can get my feet into the frame. That looks good. Alright, so the first thing you've got to keep in mind when having good posture is that in order to have a stable, upright spine, you need a good, solid base for that spine. Alright? And the base starts at the feet, at the knees, and at the pelvis. Alright? So the first place to start, I always tell people, is soft knees. Right? You should never stand with your knees locked. In fact, horses, they actually sleep standing up with soft knees, and that way it helps them, they're not in an unstable position that way. Basically, with the knees locked, you're going to be in an unstable position. So here's what it looks like with our knees locked, right? We see knees locked, the pelvis goes forward, my shoulders sink backwards, and my head comes forward because I'm trying to keep my head over my center of gravity, right? This is a really unstable position. If anyone was to bump into me, I would just fall down because I'm unstable. So we want to think about soft knees. It's a very slight bend in the knee, all right? It's not here. We're not in a half squat position or quarter squat. We want to keep the legs nice and straight with a soft bend. So I know I have pants on, it's probably a little hard to visualize this, but it's the difference from here to here. So the leg is still straight, but the knees are bent. So we start with a good base. You know, if you were only to do one of the things I tell you to do today, it would be soft knees. That would get you very, very far on the road to better posture. So we're going to start with soft knees. Now the second thing I want you to focus on is the hips, right? I hear a lot of talk about squeezing the core, tucking the butt in, right, and holding everything in this nice tight position. There's nothing normal about walking around with a tight butt and a tight abdomen. That's going to be impossible to maintain. It's going to be very uncomfortable, right? So instead of a tight belly and a tight butt, I want you to soften the knees and then relax the belly, okay? Breathe into the belly. And as you do that, what you should notice is that the hips actually start to fall forward a little bit, right? So they're going to start to come out of this scared dog, this tucked position, and start to lift. The glutes are going to lift, the pelvis is going to shift forward, and my belly is going to start to be a little bit in front of my pelvis, right? It almost looks like I'm pregnant. I did just eat a big lunch, so I've kind of got a little bit of a food baby. All right, so we're thinking soft belly. Let this just soften. The front of the body should be soft. The pelvis should start to drop down. Now, another cue that I give people is that think about you have these guns coming off of the point of your pelvis, right? You don't want to be shooting the sky up. You want to be shooting down towards the ground. So we want this slight, what we call anteversion of the pelvis. Now, if you just do those two things, you're going to be well on your road to having better posture, right? The last thing you want to think about is just a nice upright spine, right? We don't want to be forcing it. This isn't, we shouldn't have the chest puffed out like this. I shouldn't be contracting the muscles in my upper back. I just want to be in a nice, relaxed position. So again, with a nice soft belly, we want a nice soft chest. We want the shoulder muscles relaxed. The best way to achieve this is with a simple shoulder roll. So we're going to take the shoulders from this forward slumped position, and we're just going to gently ratchet them back and let them sit down and in place. Right? So the arm should be about the posterior aspect of the ribs and just sort of hanging gently in place. Right? I don't need to be squeezing my shoulder blades together. I just want to have my chest in an upright position. I'm not forcing it. My shoulders backing down in a comfortable position. So again, to recap, we've got soft knees, soft belly, a little bit of a forward tilt in the pelvis, and soft shoulders. And the final thing we need to do is get that neck back in line. And the best way we get the neck back in line is just to think about a string pulling us up to the top of our head, right? I got another great cue from a yoga instructor one time, and instead of thinking about a string pulling me up to the top of my head, if you gently press down through your heels, it'll look just like this. If I press down through my heels, that automatically starts to stand the body upright again. Alright guys, I think this just about does it for my first video. If you have any questions, please feel free to give me a call. Come into the office. I would be happy to show you these things in person. We could fine tune it a little bit if you have any comments or concerns or questions. I hope you enjoyed the information. Look out for some other casual YouTube experiences from Dr. Mike Murray, Brooklyn Body Blossom, Williamsburg, New York. All right, everybody, have a great